Hello and welcome to Beyond Travel Risk Management, a GBTA Global Business Travel Association webinar. This webinar is made possible by Everbridge. Thank you very much for your sponsorship and partnership. It is my honor to introduce you all to today's moderator for the webinar from Everbridge, Eric Chetwynd, Senior Product Marketing Director from Everbridge. Welcome, Eric, and thank you again.
Thanks, Dawn, and thank you for the kind welcome, and thank you everybody for joining us today. As in today's agenda, I'll go quickly through what we want to cover today. So, want to share a little bit with all of you a few things around travel risk management. The first is kind of the evolving risk landscape. As we work with customers on a daily basis, we see this risk landscape changing over the past couple of years. And I want to share a little bit of insight from that with all of you that can help. And then how does that impact travel risk management? What are changes in travel risk management? And also duty of care for corporations around the globe. I'll then go through a little bit of some of the elements of a successful travel risk management program. We certainly won't cover everything, but I want to give you some highlights to think about that maybe you could take to next steps for your programs. And that'll give you a couple of examples that we've worked through with customers of travel risk management in action, and then we'll have some time for Q&A. So with that being said, maybe just to set the stage, all of us have lived over the past couple of years through COVID-19, which has significantly impacted organizations around the globe, as well as, frankly, also in our personal lives. And has really changed the way that organizations think about the types of events that can impact the resilience of your organization, which extends both to operations as well as your people wherever they are. But at the same time, right, we've had many other events, the frequency of which have also increased around the globe that impact organizations. And so that's made this sort of risk landscape very complex for organizations to think about and difficult to respond and mitigate those risks that can impact your organization. You only really need to look at headlines, and this is just a small sampling to see some of these types of events happening, ranging everywhere from obviously weather and natural disasters over to civil unrest, which we've seen significant issues with around the globe. Certainly in the IT realm, cyber security, ransomware, et cetera, those kinds of elements we've also seen. As well as direct threats like active assailants, or we'll talk a little bit at the end here about even wars that are going on, right? All these events are happening, and organizations are being impacted by them on a regular basis. And in many cases, we used to think of these as sort of sentinel events, right? Some big event happens, we need to be ready. But I think what many organizations, at least in our experience, are really feeling is that these events are happening more concurrently, where I have to manage multiple events at the same time that could impact either my organization and or my people. So the way we think about this, at least at Everbridge, and when we discuss with our customers, is kind of in two really core realms that I'll discuss today. When these kinds of events happen and the risk that we're talking about with those events happen, we think about them certainly in the first realm around people, right? The people who work at your organization are, the most important asset to your organization. And the types of events that we see impacting them, this is just a small sampling. We talked about civil unrest, active assailants. And that's become a little more complicated when we think about things like lone worker, health and safety, travelers, which obviously we're going to talk at length about today. On the right-hand side, though, many of the events that there are a number of events that not only affect our people, but also impact our organization, man-made disasters, severe weather, utility disruptions. And these are on the rise and happening concurrently, right, to our folks around the globe. So when you think about those, and we sort of think about travel risk management, people risk, right? Why is it so hard to manage through these? These are happening more frequently, for sure. In the first thing that we commonly find is it's just very difficult to anticipate the things that are going to impact your organization, right? So we often walk into, whether it's you're monitoring your operations or whether you're monitoring your people around the globe as they're working, traveling, et cetera, it's difficult to know when an event is kind of coming their way. So that can be a first key point. The second key area is that it's often, particularly depending on the size of your organization and your structure, it's difficult to respond. We often find that the responsibility for responding sits in different teams, right? We might have a large weather event happen, and we have to bring together HR, and we have to bring together security, and we have to bring together the travel team. All those things have to happen at once. And in many cases, in many organizations, we have just different processes, different tools. There's kind of no common view of what's happening, particularly with larger scale events. And then the last area that we often see is it's difficult for organizations to understand how to improve over time, right? When events happen, both during an event, how do you continuously improve and understand from an operational picture what is actually happening? And share that across the teams, but also how do you improve over time, right? How do you take back those lessons learned from your last response and build further resilience into your organization, into your travel risk management program? All right. So, while all this is going on, the one thing that we've seen as a trend around the globe that impacts corporations is the extension of duty of care. And so I'm sure many of you are familiar with this, but duty of care is essentially the legal and moral obligation that a corporation has to its workers wherever they're working, right? And now, coming out of COVID, one of the big impacts is that workplace is now anywhere in the globe, right? That folks could be working. So we're not just typically talking about just travelers anymore, but we're talking about remote employees, hybrid employees, et cetera. And you can see that in the trends that are happening, right? So first and foremost, I'm sure many of you on the call here know this as well as I do, right? We know that travel, business travel is increasing, not quite back to COVID-19 levels yet, but that population of folks who are covered by our duty of care is increasing within our organizations. But at the same time, we see an increase in this idea of the primarily working at home, or the remote worker, or the hybrid worker, right? Whatever we might think of, which again is another set of folks who have similar, and I'll talk a little bit about this, have similar needs, but may not just be traveling per se for a sales call, but have this idea that they're not in your corporate setting where you have lots of support for your folks that are there. And so we've taken this shift where maybe pre-COVID, 20% of our population, our workforce population, might have been travelers or the force that was in the field, to now it's more like it has shifted the other way, right? We're more on the 80-20, where most people are not in a corporate setting, and many people versus a smaller population that's going to the corporate setting. And in response to this, or in parallel to this, we see standards organizations, we see governments really working on extending this idea of duty of care. The one we'll talk a little bit about more here is the ISO 3130, which I'm sure many of you have seen, that new emerging standard that's coming out about what are the steps in a travel risk management program. What are the things you should be thinking about and implementing within your organization from a standards perspective. But that's certainly not the only thing that's going on. We've actually seen other places. This is a quick snapshot of for example, in the UK, where they're talking about extending duty of care and that they're calling protect duty, but the same kind of idea to public spaces. And so this would be, from an employer's perspective, what's our obligation, what's our mitigation strategy for if our employees attend an event, for example, at a large public venue, right? What's the obligation around that? Or if we run large public venues, what's our obligation from an organization's perspective there? So again, just highlighting that duty of care is really rising up within prioritization for organizations, and is being extended at the same time by governments and standards bodies around the globe. And that That particular one, just we're going to dive a little bit more into the ISO standard. That's just for those who are taking notes. That's 3130 is the name of that, and you can see it listed up here. And this standard, by the way, just really solidifies a lot of common elements that you probably want to think about with really any risk management program, but has obviously specific details for travel risk, right? And at a high level, it kind of has three key areas of work, right? Once you've identified your traveling population and et cetera, and you think about the risk that's going to exist in their destination location where they're going to work, you can either do risk avoidance, right? So you can do things like prevent people from going to those particular locations. Pre-trip authorizations is a very common one that many organizations implement. You can do risk sharing, right? Mitigation through sharing of either with an insurance provider, for example, or assistance programs, those kinds of things where you're kind of mitigating your risk that way. And then we'll talk at length here about risk reduction, which are different programs and services that you can put in place depending on the risk that really exists to your folks at the destination to mitigate that risk so that you can still do business in that area, but you're mitigating the risk to your people while taking on that risk. So with that being said, I think we'll probably take a moment for our first polling question. I don't know, Don, if you want to bring that up. Okay. So just to go through, I mean, if you could just share, who's covered by your current organization's duty of care travel risk management program. Great, I see the answers coming in, fantastic. Perfect. Okay. Looks like we have a good response rate. Thank you, everyone, for sharing that. And looking at the results here, actually, it's good news to hear that those of you who do have programs in place are thinking about not just short-term travel, but longer-term, longer assignment folks as well. And really this idea of remote workers. So it looks like a number of you are thinking about that. So that's fantastic. We'll talk a little bit more about those elements as we go through the rest here. All right. Let me close this out. So, when we think about a program, what do you really need to put in place, or what are some things you need to think about? The first and really foremost thing is that we often find is you really just need to know if your people are going to be in harm's way, right? Whether that's, again, wherever they may be traveling, wherever they may be doing work, how do you know they're going to be in harm's way? How do you prepare for that hopefully before they are, right? The second is the ability to respond to the needs of those workers should they run into an incident, right? Should something happen, they're out working, and how do you respond and provide them the support they need in these different environments? And of course, the last but certainly not least is how do you improve these elements over time? How do you build in a continuous improvement cycle? So some of the things to think about on the no side is obviously first and foremost, you really need to know where your people are, right? You need to know, obviously, not just, hey, Sally's working in the corporate office today, but we need to know where people are going to be, where people are traveling to, what methods of travel they might be on. And all that's very important because it's going to be very important to understand whether risk events, whether things that are happening in the world are going to impact them, right? The second is you need to have a good context of what are the risks at their destination, whether it's in another country, another city, whatever it might be. What are the risks that exist, which are going to help inform your preventative measures that you're going to put in place with your folks, as well as what you might have to monitor from a risk perspective, from a program risk perspective. How ready are your people? This is one that we've seen increasing increasing drive towards and requests from customers around, which is not just preparedness on awareness, which is certainly key, right? Safety training, those kinds of things. Again, depending on the level of risk within a destination site, but medical readiness, vaccines, for example, those kinds of things. And then really a rising one we'll talk a little bit about is mental preparedness, right? There's a lot of work going on right now about how do you support your folks from a mental well-being perspective, particularly on longer term assignments, those kinds of things. And then on the response side, right? We'll talk a little bit about some of the risk mitigation programs that folks typically put in place. And so, things like secure journey management, for example, might be a risk mitigation program that you put in place. Risk event monitoring and response. So certainly the ability to understand when an incident or an event actually happens and it impacts your folks where they're working, right? And then the ability to respond to that, which often we find with organizations, particularly when we get out of the core corporate environments, involves reaching out and getting assistance outside of your organization, hiring in assistance teams, whether it's medical, security, operational, those kinds of things, to really extend the reach of your teams to provide that support of folks in the field. And then the last element here is just the ability for your folks, and I'll talk a little bit about some of the things that are available here, for your folks to ask for help when they need it, right? How do they check in so they're safe? How do they, say I'm in trouble or I need assistance? Those kinds of things, and how do you do that in a way that's automated, et cetera. On the improved side, certainly things like debriefs, understanding post event what's happened, et cetera. Post incident follow up with employees, such as your EAP programs, for example. And then, of course, policy development and refinement, right? The continuous improvement is really, and you'll see this in the ISO 3132, if you take a look at that, a lot about how do you build that policy? How do you continue to develop and refine that policy over time? So I'm going to cover a few elements in a little more detail, just to give you some detailed flavors. So on the plan and prepare side, we tend to think of this as sort of two categories, which I highlighted. How ready is your business? So things like, if you have and these are rising in importance, right? If you have a meeting venue that's not your corporate site, where folks are getting together, what's the threat level or the risk level at that site? What mitigation programs can you put in place? How do you plan for that so folks are safe and secure in that site? Certainly business contingency, crisis management, those kinds of things. And then, of course, travel risk policy. We'll talk a little bit about here at the end that, gap analysis, understanding where you are. We'll recommend some tools following here that can help you understand where you might have gaps in the program, but that's certainly a key part here as well. And then the second part is really how ready are your people, right? How prepared are your people for the environment they're going to be working in? And I listed some of them here, some of the medical screenings, consultations, those kinds of things, and support. But again, I think, one of the interesting findings, we just did a survey with a number of our customers around mental health. And one of the feedback from that was you can see significantly increased for frequent travelers, for folks who are basically more in those remote settings, unsupported, or not in your corporate setting, I should say. There's a significantly more of them feel lower rate of mental well-being, whether that's loneliness, feel like they're not prioritized, et cetera. And all that has obviously impact on your employees, right? From not only mental health, but also productivity and longevity perspective, et cetera. So just some things to think about there. On the knowledge and sort of safety awareness, right? Again, thinking about what's the risk of the place they're going, what's the health risk, what's the health environment. If we have Angola up on the screen here, if your folks are traveling to Angola, what's that health environment look like? What's the security situation? What's what's business like there? What are the risks around corruption and those kinds of things? How do I get a picture that forearms both my traveler or my person who's going to work there as well as the team? And then on the education side, how do I provide personal support to our folks? How do I prepare them from really from their perspective? women traveling alone in certain countries, right? The risk level for that and the things you need to think about and the kind of recommendations there might be significantly different than certainly here in North America or in a European country, all right? Or LGBTQ countries, people who are traveling, for example, or, you know, what are the big medical risks like malaria, diphtheria, those kind of things. How do we prepare people for those? All that is certainly building resilience into our folks as they go out into the field. When we talk about I mentioned a little bit about monitoring risk, and there are a number of solutions out there. I think, you know, the key component here is to have the ability to really understand events that are happening around the globe or in places where you have work occurring and correlating those to where your people are or maybe. So for example, from a travel perspective, just to put this in context, right? If I have civil unrest, if I have a protest that's happening in Marseille or a strike, for example, you know, who are my folks, not only who are currently located there, but might be traveling there in the next couple of days? How are they traveling? You know, if it's a rail strike, maybe I want to get specific to folks who are on, you know, who are actually planning to ride and say you should find an alternate method of transportation, for example, right? So it's really important to be able to correlate these. And again, that's more of a strike level, but I mean, if it's a weather event, if it's a security event, those kinds of things, you want to be able to have that kind of 360 view of the things as much as possible that are impacting your folks. And then again, a number of these out there, we'll talk a little bit about some of the elements of personal tools, certainly the ability to communicate with your folks in the field, right? Outside of just maybe corporate email, although, you know, that can help, but I think how do you provide additional capabilities? How do you provide the ability for them as individuals to gain additional insight? So for example, if I'm traveling to another country, what are the current medical regulations? What are the current, you know, visa regulations? How do I provide all that backdrop to them? How do I allow them, you know, if they have a medical issue, call for medical help, call for security help, you know, press, you know, I just need help and I'm not even sure what it is. All those kinds of support are key elements of trying to provide support to your folks in the field. And then I talked a little bit about extending your team, and you know, the common two core areas that we see this is really how do I provide access to medical and security with some operational there support for folks who are in the field. And I'll give you a couple of examples in a minute. But really the key here is that if you're going to extend the reach of your team by bringing one of these services, you really need, you know, 24/7, 365, obviously kind of support with multilingual support, because quite often these kinds of services are working with local authorities, local teams as well, who might normally provide the support, you know, from a healthcare or security perspective in the area. And I'll talk a little bit about, you know, what an example of that might look like and why you want that. In addition, you know, it's really key to have here an integrated global response organization. And the reason for that is, you know, many cases when events like this happen, in particular for travelers, they happen over you know, your organization might be located in London and your folks are actually working out of you know, Angola in this case, right? If we pick our earlier example, and we might have other folks that we need to bring in. So you just need that ability to bring the whole team together, provide a unified response for your folks. Those integrated teams really provide the best impact and support for folks. And then there are some, you know, there are special services to think about, excuse me, like secure journey management. How, you know, if you're going to a high risk environment, how do you make sure folks can travel from the airport to their long stay residence, for example? Event coverage, if you're going to run an event, for example, what does that look like? How do you provide medical support to that? How do you provide security support depending on where it's located? So just some things to think about there. And with that, I think we'll jump to our second polling question. And so this one is really, you know, what kind of support do you have in place for preparing your travelers today? So if we'll take a minute and put that up on the screen. Well, it's looking good. Give it another couple seconds here. All right, looks like we're settling in. Thank you, everybody, for your replies. It's good to see many of you certainly have the pre-trip briefings and et cetera in place today. Those are certainly that all those educational elements are certainly key. We'll talk a little bit. Yeah, there looks like there's probably for some of you maybe some more learning around the medical and the mental health side that you could explore. So really interesting results. Thank you all for sharing those with us. All right, let's so let me just walk through a couple of examples of what these kind of programs could look like in action, right? And these are two medical examples, but I think they'll give you a flavor of some of the needs here. The one on the left here, we won't read all of it here. You'll have access to the slides after today's presentation. But this was really a traveler who in Brazil, you can see here diagnosed with thrombosis. So that particular condition has a very short response rate from a clinical perspective, with a 50% mortality rate, right? So if there's not an appropriate treatment within essentially 24 hours, that person's at high risk. And in this particular case, the team that was on the ground, the local hospital, really didn't have the support in place to do the appropriate procedures. So this particular one, required not only identification of the issue, obviously, and the person being able to ask for help, but also the ability for us to bring together, a team, security, medical, and operational personnel to provide clinical support, provide that support for the traveler, family members, et cetera, and then coordinate the evacuation of that person to a location, in this case, a 3,000-kilometer trip, where they could perform the procedure and then follow-up could happen, right? So this is an example of, depending on where you might be working, where you might not have the support in place. A similar story here on the right, but with a slightly different case. This is more of a family member, right? So I noticed when we were in the earlier poll, a number of you indicated that families are covered by these programs for you, which is great. So in this case, we had a daughter of one of our workers who basically had recurring kidney infections. And in this case, they were in China, and it was difficult for the local clinical team to actually diagnose the issue. And so bringing outside support, outside clinicians to be able to say, hey, we need to go get an MRI, diagnose this issue, determine the treatment plan. In this particular case, again, it did lead to an evacuation to an alternate clinical location for delivering that care, as well as post-treatment follow-up, right? Case management post the event. So just a couple of quick medical examples. Often we see, while security and medical are all key elements, many of the cases that we see are certainly medical, right? And there are lots of places where additional medical support is needed for folks in the field. The last story I'm going to just share here is, you'll probably all guess, is about actually the invasion of Ukraine. And I think it's an important one, although we certainly don't have war, thankfully, events happening all the time. But it does show you the coordination outside of just a medical response of what it really means during a security situation to bring folks together. So to give you an example here, this is one we had worked on here. When the invasion of Ukraine was determined, we had a number of customers who had actual employees, long-term employees working in country in Ukraine. And so in preparation for a potential invasion, our security operations and assistance teams began to coordinate a response should the invasion happen, which in this case was commercially evacuating folks on commercial flights. So that was plan A. And then the invasion happened, and of course, Ukrainian commercial space was shut down. And so those commercial flights were no longer available to evacuate. In that case, again, this is an example where we had folks monitoring the risk landscape, understanding, what events were happening. And so in response to that, the operations teams got together and communicated. Again, another key reason why you have to have communication capabilities for all your folks with all those impacted employees to say, we'll evacuate you within 72 hours. Here's how to build a to-go bag. Make sure you pack the appropriate things, et cetera, et cetera. We'll come in and do ground evacuations. Once, by monitoring that risk profile, in this particular case, they were monitoring for invasion routes from the Russians. And as they determined where the invasion routes were, they could rapidly and dynamically change the evacuation routes. And so within 72 hours, they had enough of a picture where they could go in with buses, essentially, and security personnel who ran as scouts ahead of those convoys to start to evacuate employees out of the country. In this case, originally through Poland, and once those, again, monitoring the situation closely, once those checkpoints became clogged with refugees, they actually shipped it to Slovakia. And once they got there, they received medical help, were put up, or were actually taken out of country, flown back home, right? And so the outcome from this particular event, at least in our experience, and I know there are other organizations who did similar things, was the evacuation of 120 of the employees who wished to evacuate. Some chose to stay in country, and then we actually brought out some non-employee refugees as well as part of that program. But I think it's a good example of how all elements can come together. Obviously, it's a large-scale event, but again, this is probably not something, even though you could see here, one of our customers is a large cosmetics company, they would not have had the ability to support this on their own. So really need that additional services. All right, well, those are sort of the remarks I have prepared for everybody today, and hopefully gave you kind of a high flavor of some of the elements of travel risk. I think what we'll do now is just go into a little bit of Q&A and try and answer some questions for everybody. Let's see. Let me see if we can. So I'll ask either Anupria or Don, if I know you've been monitoring the window, if you see questions that folks have. If you have a question, I think if you could type it into the chat. So I do see one question here. Maybe I'll just pick this one up while folks are doing, which is about how COVID has impacted, threat assessments of broader infectious disease threats. I think, I'm sure you're all experiencing this. I would say pre-COVID, both for travel and frankly, even at the level of corporate risk, infectious disease just wasn't, it wasn't a core part of, it wasn't a high priority item for many folks to think about. When we all thought about infectious diseases, I'll speak, I'm based in North America, so I'll speak for North America. We were thinking about Ebola and, swine flu and those kinds of things, which tended to be more localized clinical events, not nearly as widespread. I think post-event, it does actually, we see it as a much higher priority item. And even if it's not COVID, folks are thinking about, for example, what are the travel restrictions and regulations around coming in with any sort of medical condition for moving from country to country. So we do see that as a rise in there. And in the duty of care space, even outside of travel, it has extended. I know there was, for example, a law here in California in North America, which really extended significantly, how proactively corporations actually had to take risks to mitigate COVID. Otherwise, it ran into workers' comp issues, right, where those workers could actually be compensated for, catching COVID, basically. So, so good question that I definitely see often. So I'll take a couple more here. So, this is really about Everbridge, but do we provide, security education? We do. So I think we do monitor cybersecurity threats around the globe. And I would say that, that is one that area is an area that we often see, particularly for travelers, as well as, frankly, remote workers, people who are not in your corporate setting. When we think about the endpoint of the device, right, that's an increasingly higher focus area for organizations because you have so many folks dispersed. in different areas. So it's much harder to secure things. So good question. Quick question here about, and actually a really great one. If you're at a place where you really don't have a firm travel risk management program, how do you get started, right? And one of the things a couple things I would highlight as tools. I think we're planning to follow up with all of you with, I know, deck and et cetera. I think one of the things that we want to share with all of you is we do have an ISO 3130 benchmarking tool that you can use to kind of benchmark where your program is. And that's certainly a great way to start the conversation around a standard that ISO has put in place that you can share them with your senior team about where compliance sits, et cetera. We also have a number, and so do many of the other vendors in the market have a number of white papers that talk about the ROI and the value of some of these programs. So, and particularly when you think of it, not just from travel risk, but if you think of it as now this hybrid mobile work, how do you extend out to folks who just don't have the support, and what is the impact? Things like lost productivity, what does that really mean for an organization? So those are some of the ways you can certainly start the conversation. Couple of questions here. I'll pick up. One is, how often does a frequent traveler need a pre-travel briefing? Yeah, so and this is just talking about, do the risk levels really change often? If somebody's going into a country, I guess what I would say from just a briefing perspective, the briefing might not be significantly different, right? The way they do business, the corruption level, and those kinds of things. But there might be events that are happening in country that certainly weren't that do change rapidly over time. So I think it is important to kind of get the latest and greatest information into the hands of your travelers, even if they continually travel to the same location, which I think is sort of the genesis of that question. Quick question here about what are good resources for information around travel restrictions, safety concerns, et cetera. Obviously, I work at Everbridge. I can tell you that Everbridge provides that capability through tools that we have, as well as through partners. So, one good partner that we work with, for example, is Sherpa, which does a lot around COVID regulations, and you can certainly access that on their website as well. So there are definitely tools out there for looking at that. One second. So quick question on the importance of having the ability to track where your folks are, and how important is that? And I think, if you were to take away one comment here, if you can implement such a thing, if you can implement a program like that, depending on, especially if you have a large number of travelers or folks in the field, that can make a significant impact, can be significantly important for your organization, especially if you're entering environments where, again, it's not your corporate home environment, right? The alternative, maybe I'll talk about the alternative that we often find, is things like we're going to watch the news or we're going to watch the weather. And that certainly picks up some things for you, but often the ability to respond quickly around those kinds of feeds just on their own is a lot less than, working with one of the risk monitoring vendors to bring in, that differing levels. And there are differing levels out there that you can bring into your organization. All right. Looks like we are answering them all. And I think we answered, I do see one about the ISO doc. Hopefully you all caught it. It's 3130, and it will be in 3130 2021, I think is the official, but and it will be in the deck for you as well. So hopefully you can look that up. And again, like I said, we'll also share with all of you at least a benchmarking tool that you can leverage to judge where you are in that journey. I think answered that. Let me just see if there are any other questions. And I don't know if Don or Nupriya, I know we're following. This is great. Everybody has a lot of good questions. Really appreciate it. Want to make sure we're not missing anything here. Looks like we caught them all. All right. Oh, one more. Yeah, so quick question about flight tracking. So Everbridge, and I think there are others that do this too. So we can certainly track today, different modes of transport. And again, I think that's another. So we think about the granularity of this, right? Thinking about the different modes of transport that people are on from a risk perspective is certainly key, and we could track that from an itinerary perspective. We do also have some flight tracking capabilities within our platform as well, which would be more around. Which not only feed into risk, but obviously would feed into typical travel management, delays and those kinds of management elements as well. So, okay. All right. Well, I don't see any more questions, Don or Nupria, so I think we could probably wrap it up. But I just want to take a moment to thank all of you for your time today. Really appreciate it and all the great questions. We'll be sharing some information, after today's discussion, and certainly hope if you have further questions, you'll reach out to us. We're happy to help and guide in any way possible. So thank you all.